not telling you how to reverse your condition, find yourself another doctor.
My name is Dr. David Dunaief, and I am an integrative medicine physician, and I went to Stony Brook Medical School, and I'm opening a second practice. I have one in Stony Brook now, and I'm opening a second practice in Brooklyn. And I've been seeing patients now for over 7 years in my own practices. And I've worked with a very well-known physician named Joel Fuhrman, who wrote Eat to Live, which is a very well-received book. It's much easier to put people on medication than just to take them off medication. But the better thing to do is to take patients off medication with lifestyle modifications. You can actually reverse disease, whereas medication is only treating the symptoms. So you're not getting the actual benefit, and you end up being on medications for years, and you end up with side effects. So the medications can actually be worse for you sometimes than the disease itself. So the goal is to get off medication, but to get off medication by earning it through lifestyle modifications. Well, it's a really good question why more doctors aren't speaking this way. There actually are more and more doctors doing it. However, the problem is that in medical school, we're taught more about the pharmaceutical and more about writing the drugs and treating the disease rather than treating the whole patient. And I believe that it's a whole body approach where no body is the same. Not nobody, but no body is the same. And so you need to take an approach from looking at the whole body, which means you also need to take the approach of a lifestyle modification, because drugs only treat one ailment at a time. So people don't have the knowledge of this, and unfortunately in medical school we don't learn this. This is not what we learn. We learn about drugs, we learn about surgery, but we really don't learn about nutrition. We have a course that's put in, usually squeezed between anatomy and biochemistry, and what we care about at that point is anatomy, and we're worried about how to do that. So we don't learn a lot until we get out, and then we find people who are integrative or lifestyle medicine physicians, and we do fellowships with them, and that's how we learn. But we have to have a passion for it, and unfortunately there are not enough people that have a passion or know that they can do this. Richard Ablin, who's against the PSA, who is the one who came out with it, he's not against the PSA, he's against using it as a screening tool for prostate cancer. And the reason is that PSA can go up whether you have a cold, whether you have prostate cancer, whether you have an enlarged prostate called benign prostate hyperplasia. It can go up if you're rowing, for instance, if you do crew, or if you sit in a canoe and you're rowing and your prostate gets pressure, or you're riding a bike, your PSA can go up. So it can look like something like prostate cancer when it really isn't. The use for a PSA is to have someone followed when they have prostate cancer. However, you can also use a PSA when you have someone on a plant-based diet to get a baseline, and then when you take them off animal protein, their PSA goes down. And when you give them more green, dark, leafy vegetables, their PSA continues to go down. So you can use it in that way. And in fact, my father died of prostate cancer at the age of 50. And he was doing everything the wrong way. He was eating meats and liver, which had twice the blood supply, and the iron from the blood actually probably exacerbated his prostate cancer. And he had prostate cancer for 5.5 years. But we didn't even have the PSA when he had it, and if we did, we could have at least tracked his prostate cancer progress. And I wish I could take a car back in time with Back to the Future and at least have presented him with the information we have now. So I'd like nobody to be in that situation, but the PSA is not the answer for diagnosing prostate cancer. So what happens is the PSA is not harmless in itself, because once you get a PSA and it's high, say the PSA is above 4, but say it's more like 8, 9, you're going to then go down what's called the medical rabbit hole, which means that then to confirm it, they want to do a biopsy. A biopsy is an invasive procedure that causes potentially people to have erectile dysfunction and causes them to be incontinent. So it's not without its dangers, and it's a painful procedure. And then you can also miss the cancer when you do a biopsy because you're only looking at a few parts. So it's not a perfect test anyway to get a biopsy, but there are side effects that can make a man impotent from getting these biopsies, and you can also bleed from them. So the problem is that we don't have definitive studies that say, okay, prostate cancer can be reversed by doing lifestyle modification. What we do is we have preliminary data that is very, very good from, say, Dr. Dean Ornish at UCSF, who's done several trials that showed the reversal of prostate cancer, early prostate cancer, with lifestyle modification. And in my clinical experience, I've seen a lot of good results with prostate cancer and other cancers by reducing the biomarkers and the inflammation, and you can see that dramatic change. But there is no definitive data, so the actual medical establishment can blow back at us and say, well, there's no proof. But there's never proof in medicine. There's not even proof in medicine using medications or using surgery. If you want to contact me, again, my name is Dr. David Dunaief. I'm in Brooklyn at 41 Clark Street, and my website address is medicalcompassmd.com, and you can go on there and find me. And again, it's medicalcompassmd.com.